Welcome back to my channel Surgery Nuggets by Dr. Himasri. Let's discuss today a very common surgical condition, that is hydrocele. So what is hydrocele? Basically, it is an abnormal collection of serous fluid between parietal and visceral layers of tunica vaginalis of testis. To understand the pathophysiology better, first we have to know the anatomy. So here you can see in this diagram, I have shown different layers of the scrotum. So this is the testis. This is the testis and above it is the epididymis. This is the body of the epididymis. Now testis is covered by the visceral layer of tunica vaginalis. Tunica vaginalis has another layer. This one is parietal layer of tunica vaginalis. So, if due to any reason there is fluid accumulation between the two layers of the tunica vaginalis, the condition is known as hydrocele. So here you can see different layers of the scrotal wall. First, from the outside in, we can see skin, then superficial dartos fascia of the scrotum, then we have external spermatic fascia, next is cremaster muscle and fascia, next we have internal spermatic fascia, and then comes the tunica vaginalis. So first we have the parietal layer of tunica vaginalis, then this is the epididymis and the testis covered by visceral layer of tunica vaginalis. Then comes the testis. So what is pathophysiology of hydrocele formation? We have two theories. First one is defective absorption. So what happens if there is some low grade infection or damage to the endothelial wall? Then the absorption of fluid by the tunica vaginalis is affected and results in fluid accumulation between the two layers of tunica. Second is excessive production of fluid. Excessive production of fluid is seen in cases of secondary hydrocele. So what happens in secondary hydrocele? It can be because of some trauma, some tumors of the testes, or diseases like tuberculosis, which causes more production of fluid between the two layers of tunica vaginalis. So how do you classify? Classification of hydrocele. It can be congenital or acquired variety. The acquired type of hydrocele can be subdivided into primary and secondary. What is congenital hydrocele? See, in congenital hydrocele, the processus vaginalis remains patent. What is processus vaginalis? Processus vaginalis is nothing but the embryological origin of tunica vaginalis. So, if this processus vaginalis is not obliterated, it may lead to different conditions. One of them is congenital hydrocele. There is communication with the peritoneal cavity. As you can see from this diagram, this is the testis. So in this diagram, this is the testis, and this is the deep inguinal ring. So you can see there is a communication with peritoneal cavity, but the communication at the deep ring is too narrow to admit bowel or omentum. So there is no hernia. Now the acquired hydrocele. Acquired hydroceles may be divided into primary and secondary types. The basic differences I have listed in this table. So age-wise you can see primary hydrocele are more common in young age group, whereas secondary hydrocele are more common in middle age group. Size of primary hydrocele, they are big and tense. Secondary hydrocele usually small and lax. In primary hydrocele, we cannot palpate the testis separately because the testis is entirely covered by the fluid. It is surrounded by the fluid, so we cannot palpate the testis separately, and the swelling is also huge. But in secondary hydrocele, as the amount of fluid is small, we may palpate the testis separately. Transillumination test. Transillumination test usually positive in primary hydrocele, whereas in secondary hydrocele there may be some infection or pus inside the cavity, so it may be negative. Causes of primary hydrocele, it is idiopathic, and secondary hydrocele is secondary to some diseases like infection, tuberculosis, some trauma, or any tumors of the testis, which can also be malignant tumors. Coming to infantile hydrocele. In infantile hydrocele, the tunica and the processus vaginalis both are distended up to the deep inguinal ring. Here, this is the deep inguinal ring, and both processus vaginalis and tunica vaginalis are distended up to the deep inguinal ring, but there is no communication with the peritoneal cavity. Whereas in congenital hydrocele, there was a clear communication with the peritoneal cavity. So this is the only difference between congenital and infantile hydrocele. And also, infantile hydrocele does not necessarily appear in infants, though the name suggests so. Coming to funicular hydrocele. Now, what is funicular process? What is funicular process? It is nothing but the middle part of the processus vaginalis. So, if the funicular process is closed just above the tunica vaginalis, here you can see just above the tunica vaginalis, the funicular process is closed, and it is basically a inguinal swelling. It is basically an inguinal swelling rather than a scrotal swelling. And this funicular hydrocele is very rare. Next is hydrocele of hernial sac. Yes, this one is a hernia sac. This is omentum. These are omentum or bowel content, you can say. Sometimes what happens, the neck of the hernial sac is closed by adhesion or plugged with omentum, and this result in retention of the serous fluid secreted by peritoneum of the hernial sac, which result in hydrocele formation. Coming to encysted hydrocele of cord. A portion of funicular process persists and remains patent, but this kind of hydrocele, they are shut off from the tunica vaginalis below and peritoneal cavity above. So this is the cystic cavity. Now, how to identify encysted hydrocele of cord? We can do traction test. So what is traction test? If testis is pulled down, this swelling will also come down and become immobile. So traction test positive in case of encysted hydrocele of cord. Another variety of hydrocele is bilocular hydrocele. So bilocular hydrocele means there is two communicating swelling. One above the neck of the scrotum, one is below the neck of the scrotum. So these two are communicating. And how to identify this kind of swelling? These are cross-fluctuant swelling. Can you tell me another condition where cross-fluctuation test positive? Yes, another condition is plunging ranula. So in plunging ranula, and next is Swas abscess. In these two conditions also cross fluctuation test is positive. Okay. Pyocele. What is pyocele? It is nothing but a sequel of hydrocele. If the hydrocele gets infected due to some reason, the serous fluid becomes pus. So this is a suppurated hydrocele. It should be differentiated from cellulitis of scrotal wall. This diagram is a kind of summary of today's entire discussion. So this is vaginal hydrocele. As you can see, it is limited to the scrotum. This is congenital hydrocele. Here we have communication with the peritoneal cavity. Infantile hydrocele looks similar to congenital hydrocele, but there is no communication with the peritoneal cavity. Then comes the encysted hydrocele. Here you can see encysted hydrocele. And next one is bilocular hydrocele. We have two sacs intercommunicating, one above the neck of the scrotum, one below it. Bilocular hydrocele are cross-fluctuant. And last one is hydrocele of the hernial sac. In hydrocele of hernial sac, there is retention of the serous fluid secreted by peritoneum of the hernial sac. How to diagnose hydrocele? Basically, it is a clinical diagnosis. We have to diagnose from history and clinical examination. Ultrasound of bilateral inguinoscrotal region also done to rule out other traumatic or any testicular tumor. Some of the important clinical findings I have mentioned here. First one is we can get above the swelling. As it is purely a scrotal swelling, we can get above the swelling if we palpate at the root of the scrotum. Second is testis not palpable. Basically for primary hydrocele, testis is not palpable separately. Fluctuation test is positive. Transillumination test is positive. Here we can see how transillumination test is done. It is performed in darkness. A pencil torch is placed laterally over the swollen scrotum and there will be a glow, red glow appearing throughout the scrotum, indicating presence of clear fluid inside the scrotum. This can be better visualized through a roll of paper which is placed on the other side of the scrotum even in daylight. If the fluid is not clear, for example spermatocele or hematocele or pyocele, not get transillumination test. So non-reducible swelling. It is a non-reducible swelling. This helps us to differentiate it from inguinal hernia. Impulse on coughing is absent. Why we look for impulse on coughing? To rule out hernia, inguinal hernia or varicocele. Coming to the treatment part, for small hydrocele, we can do Lord's plication. If the sac is small, thin, and contains clear fluid, tunica is bunched into a ruff by placing series of multiple interrupted chromic catgut suture so as to make the sac to form a fibrous tissue. For medium hydrocele, most commonly done procedure is Jaboulet's procedure. Here, once the sac is excised partially, we evert the sac, which is called Jaboulet's procedure. For large hydrocele, if the sac is thick, we can go for subtotal excision of the sac. So this was a brief overview of hydrocele. Subscribe to my channel, like the videos. Thank you.